So as we're seeing this increasing emphasis on ACO in the market, ACOs are also increasingly starting to look at post-acute care. And we had some really interesting feedback on how post-acute care played into their plans, acknowledging that it was important, but where it fell and how they were using it was very different. So one thing we learned is that building a quality network is really hard, not surprisingly. And it's interesting how these ACOs were pursuing and managing these networks. They normally started with PCPs for obvious reasons. That's what drives the attribution. That's what drives who is in their population. So they want to make sure they have a group of PCPs that are effectively managing their patients. Then they're worried about inpatient cost. And, as they're starting to look at quality of inpatient and post-acute, they found it really hard to evaluate. And we heard that over and over again. Some of the things that they were looking at was if they had data, they were looking at readmission data, they were looking at ED, some of the things that Sam was showing on an earlier slide. And they're constantly trying to figure out how to identify who's performing well and who's not. And so as we talked about earlier, the data is so critical for being able to actually really manage a patient population through the provider partnerships that you build. And one of the things that they said off and on was that lots of times they had a hard time being aligned with their partners. An ACO has a cost and quality mandate that is unforgiving. That CMS benchmark is set and it is where it is. And they were struggling to get the partners to be aligned with working that way with them because they have some very clear goals that they have to hit. One of the other things that was interesting, I spoke to one ACO leader who said, we were so focused on our PCPs and our acute care that we didn't even think about post-acute in the early days. And that as the ACOs matured, post-acute became more and more important. I think also, if you remember that first slide, moving towards global capitation also makes the post-acute more important too. And so as time goes on, as ACOs mature, as the business processes around them mature, and as we have more and more contracts and more global capitation contracts, you're going to see more and more interest in post-acute. And one of the other things they're doing, certainly with PCPs and specialists, it'd be interesting to see how much this is going down to post-acute, and we don't have that data element, unfortunately, is that they're starting to use coding. They're looking at how services are being billed to understand what the post-acute or the provider is particularly good at and how that aligns to their goals. And so some of them are getting pretty sophisticated on how they're thinking about quality and how they're thinking about utilization as well as cost. So when we asked folks, we asked everyone, how much are you focused on post-acute care? How much does it matter? And so what's interesting is, even though it was not in the top 5 things that people thought was their number one priority, over 95%, I guess 94% said that it was at least somewhat their focus, if not very focused on post-acute care. So clearly they understand the impact that post-acute care has on their cost and quality. Whether they're able to get to the place where they're really managing it well or not seems to be another story, which, from my perspective, offers a lot of opportunity. And when we started to drill into, well, which type of post-acute are you more focused on? Same set of respondents, they undeniably said their first priority was SNF. And when asked why, at least a couple of them said it was because of the dollar amount. So if you're following the story, it starts to become very clear, right? They focus on the PCPs to build their growth. They focus on the inpatient because of the highest cost value comes from that inpatient area. And then they're focused on the SNF. And then they're looking at home health. And finally, hospice, although you'll see their hospice is a priority throughout for some. The opportunity with hospice is pretty huge. And I'm not sure that all of the ACOs have been able to think far enough ahead to be able to see the value that appropriately using these post-acute care settings can have on their bottom line.